This is Shelley Kraft coming to you live on SNN.Live. We're coming to you from the 2019 Disruptive Growth Conference in New York City. I have with me Erez Raphael from DarioHealth Corp. It's a publicly traded company on NASDAQ, and the symbol is DRIO. Erez, welcome back to SNN.Live.
Thanks, Shelley. Glad to be here.
It's good to have you. Let's get started with a brief overview of the company, and then we'll go from there.
Yeah, so DarioHealth is a digital therapeutics company managing lives of people with chronic conditions, both diabetes and hypertension, and can be scaled up for any chronic condition in the future.
So, what's some history behind the company?
So the company was founded in 2013. We built a platform that combines both medical device application and a lot of software to support management of chronic condition. And today we are selling a SaaS-based model, per member per month, where we are taking over the whole management of people with chronic conditions, from the monitoring device to the day-to-day management, including support and coaching that is being done in a digital way, and also by human beings that supporting them over the platform with smart advices and support in order to improve clinical outcomes.
So originally when you started this company, you saw that there was some unmet needs. Have those unmet needs changed, or are you meeting those unmet needs?
Yes, absolutely. So the market was about giving to people medical devices and monitoring devices that practically people were not very engaged with. We don't know if they were using it or not. And the user experience behind all these devices were not state of the art. What we wanted to do is to provide much better user experience, much better tools that are also digital, and help people be more engaged and empowered through these tools in order to improve clinical outcomes. So I'm happy to say that after 3 years, and today we have like around 40,000 active paying users, where we managed to show that tens of thousands of them are improving clinical outcomes in a sustainable way. Everything is shown by the data, and we are very happy that eventually we are showing payers in the United States a concrete ROI model where they are paying for something that is improving clinical outcomes for people with diabetes and with hypertension.
Where was the technology originally developed?
Yeah, so the technology is originally developed in Israel. Actually, our company is an American company with an R&D center in Israel. So we enjoy a very strong team members that are coming from Israel and knows how to build technology, both medical devices and also digital applications. And at the same time, we have a very strong team in the United States that is responsible for the commercialization, talking with the big players in the United States, and scale up our ability to sell our product and get to as many users as possible. Actually, the unit economic of our SaaS model is very profitable. We are enjoying margins of north to 65% per unit economic. And we also enjoy a very good model from an investment standpoint, because we are having a recurring revenue that once users are getting on the platform and with our good engagement, they are staying on the platform, and we keep this subscription and membership model to create recurring revenue for the company.
You stimulate a couple of other questions that I want to ask. Namely, is this data gathering that you're doing, number one, and feeding it back to the medical community? I think, I would like to ask you a question. Are you doing that?
Yeah, absolutely. So one of the strong capabilities that the platform have, because we have a very good user experience, users are sharing a lot of data, and our platform is capturing data that is not just that related to the blood sugar level or the blood pressure. It's also about lifestyle data, food, exercising, medication. Everything is captured into the platform. Obviously, we are protecting our users in terms of privacy, so this data is not shared out of the organization, but we are using this data in order to reflect it to our users and say, see how your food and how your medication impact your clinical results, you might want to do A, B, or C. And that's the way that we are leveraging on the data in order to improve clinical outcomes. And we are using some smart technologies, including artificial intelligence, in order to provide a very personalized experience to our users.
So, Erez, I wanted to also ask you about this personalized health. Explain.
Yes, absolutely. So one of the big promises of digital health and digital therapeutics is that people will get the proper treatment for them personalized, which means that if we have data and if we know our users very well, we can provide them the right treatment, digital treatment that is personalized for them. So every person has his own daily routine, and our smart technology knows how to integrate into this daily routine and provide the right message to the right person at the right time with the right data. This is how smart it is, and this is how people are changing their behavior.
So now you're a public company, so based on press releases that have come out from the company, what are some growth drivers going forward?
Yeah, absolutely. So the growth drivers are mainly the payers in the United States that are looking for cost-effective solution, looking for the right ROI. They want to pay for something that is improving clinical outcomes. They want to see it with the data. And I think that we have a very cost-effective solution. We know how to turn every smartphone to be a glucose monitor for a very small amount of money. And we add on top of that a very smart digital intervention capabilities that are improving outcomes. So it's very easy to show the ROI, and it's very easy to convince payers that we're going to give them something that will be worth the investment for them.
Erez, let's get your website out for more information, if you would.
Yeah, absolutely. So our website is DarioHealth.com. Thank you, Shelley.
Thank you. Ladies and gentlemen, Erez Raphael, DarioHealth Corp, publicly traded company on NASDAQ, and the symbol is DRIO. I'm Shelley Kraft. This is SNNLive, coming to you live from the 2019 Disruptive Growth Conference here in New York City. Erez, always a pleasure.
Thank you so much.
You are quite welcome.